Suicide is the act of killing oneself. Assisted suicide, also known as assisted dying or medical aid in dying, is suicide undertaken with the aid of another person. Assisted suicide is when another person materially helps an individual person die by suicide, such as providing tools or equipment. Once it is determined that the person's situation qualifies under the physician-assisted suicide laws for that place, the physician's assistance is usually limited to writing a prescription for a lethal dose of drugs. A doctor, knowingly and intentionally, providing a person with the knowledge or means, or both required to commit suicide, including counseling about lethal doses of drugs, prescribing such lethal doses or supplying the drugs. In many jurisdictions, helping a person die by suicide is a crime. People who support legalizing physician-assisted suicide want the people who assist in a voluntary death to be exempt from criminal prosecution for manslaughter or similar crimes. The constitutional courts of Austria, Colombia, Germany and Italy legalized assisted suicide, but their governments have not legislated or regulated the practice yet. Physician-assisted suicide is legal in some countries, under certain circumstances, including Belgium, Canada, Luxembourg, the Netherlands, New Zealand, Spain, Switzerland. The Parliament of Portugal passed the legalization of assisted suicide, but is now under consideration of the Constitutional Court. In most of those states or countries, to qualify for legal assistance, individuals who seek a physician-assisted suicide must meet certain criteria. These conditions include having a terminal illness, proving they are of sound mind, voluntarily and repeatedly expressing their wish to die, and taking the specified, lethal dose by their own hand. In other countries such as Canada, Spain, Belgium and the Netherlands, a terminal diagnosis is not a requirement and voluntary euthanasia is additionally allowed. Assisted suicide is different from euthanasia, sometimes referred to as mercy killing, where the person dying does not directly bring about their own death, but is killed in order to stop the person from experiencing further suffering. Euthanasia can occur with or without consent, and can be classified as voluntary, non-voluntary or involuntary. Killing a person who is suffering and who consents is called voluntary euthanasia. This is currently legal in some regions. If the person is unable to provide consent, it is referred to as non-voluntary euthanasia. Killing a person who does not want to die, or who is capable of giving consent and whose consent has not been solicited, is the crime of involuntary euthanasia, and is regarded as murder. Right to die is the belief that people have a right to die, either through various forms of suicide, euthanasia, refusing life-saving medical treatment. What do you think? Please leave your